BP and sugar are two diseases which will kill you silently. Suppose I can recognize a stroke symptom the moment he comes walking to my cabin, but I don't know what is his BP unless I check it. So that is most important. So now home BP check monitors are available. After COVID, it is available at a easy price, and also it is quality has improved. So BP monitoring at home is very important. Sugar control is very important. Cholesterol is very important. Smoking, if patient continues to smoke, medicines don't work. So that is very important. And in some patients, recently my student did a thesis project on how blood thinners work. Some of the blood thinners won't work in some patients, like aspirin, clopidogrel. Some of you take because of other heart issue and other issue. No, some won't work in Indian patients. So we have to keep all these things in mind. Apollo Hospitals, Bangalore. So HOSUR being a very important place for all of us, we thought we will start our Apollo Stroke Clinic. So in the same time, we thought we will give some information about stroke, which is a very serious neurological condition. If you see stroke, in India every year, if you see the ICMR statistics, the government statistics which was released 2 months back, every year 20 lakh people are suffering from stroke every year. And if you see, almost 27% of them are dying, like almost 6.5 lakhs to 7 lakh people are dying with stroke in India every year. It's a very big number. If you see globally, stroke is the second leading cause of death after heart attack. And in India, it is the third leading cause. If you see only stroke and heart attack, if you see only these two diseases, it contributes to 30% of deaths in India. So almost 1 in 3 deaths are because of these two diseases. So it is very serious brain condition. And among all the neuro condition, if we see 70% of the hospital admissions for a neuro problem is because of stroke only. So that's where, we have to be aggressive in identifying the stroke symptom. We have to treat these patients. So last 15 to 20 years, there has been a total change in the stroke treatment. The concept of golden hour has come. Golden hour is first 4.5 hours after acute stroke. If you shift the patient to a stroke ready hospital, you can actually, patient can go home. They can do, we give a clot busting medicine called IV thrombolysis. This we have been doing from 2008, but now because of the government push, because of public awareness, it is much better. So almost 20% of the people are coming in golden hour after stroke now, but it has to improve because only 20% means only 1 in 5 stroke patients are coming in golden hour. So that number has to increase. If you see in Singapore, if you see in Germany or America, that number is 50 to 60%. So our numbers are still less because of lack of awareness. So that awareness is doctor's responsibility. It is responsibility of the government. It is responsibility of the media to spread awareness. This is where, if you see Apollo Hospitals in Tamil Nadu, it runs the largest stroke program. So what is stroke? Stroke is basically because of either a blood clot in the brain or bleeding into the brain. Brain usually is supplied by 4 major blood vessels. There are 2 in the front. They are called carotid arteries, which supply 40% each. If you see 2 blood vessels in the back, that is called vertebral artery. So if there is a blockage of one of the blood vessels, so that will cause clot in the brain. If there is a clot in the brain, the surrounding nerves will die. So because of the death of the surrounding nerves, usually patient will have either weakness or loss of speech or various issues. Now, how do you recognize stroke symptom? That is very important. We always tell what is called be fast, be-fast. That is the synonym for public. B means balance. If patient has sudden loss of balance, that could be a symptom of stroke. Then E for eye sign. Suppose patient has blurring of vision, double vision, loss of vision. So that is one important feature of stroke. Then face means, you all know, the facial deviation, which is very commonly seen, very easily recognizable. If there is a facial deviation, that is also stroke. Then A is arm weakness, arm or leg, that is the paralysis part. So if there is no major paralysis, if there is a total paralysis, patient cannot lift the hand. But suppose if there is a mild weakness, what you should do, ask the patient to keep the hand like this for 10 seconds. So usually if your strength is normal, it will not move. Suppose if your strength is weak, it will start drifting like this. So we call it as arm drift or arm weakness. Then yeah, S stands for speech. Speech can be loss of speech or sudden you cannot talk, you cannot understand, you cannot make a sentence and all that. T is time to act fast because there are studies wherein it is proven that every minute after acute stroke, 1.9 million nerve cells are dying every minute after stroke. So if you don't treat a stroke patient properly, he will get older by 3.5 years. So it is a significant problem. So now what will happen? What are the risk factors? That is very important. So we call 10 risk factors contribute to 90% of strokes. Most important is hypertension, high BP. In India, there are 31.5 crore people who are having high BP. That means 1 in 3 adults are having high BP. If 50 of us are sitting here, maybe 10 to 15 may be having a BP. BP control is very important. The same government study which I showed last month it got published, 74% of patients with stroke had high BP. So that is very important to control your BP because salt intake in India is very high. Globally, it should be less than 5 grams. But in India, it is from 9 to 11 grams. We are actually more fond of pickle, salt, extra this one. So some amount of additional salt once in a while is okay. But every day, if we take extra salt, it will have lot of problems. Second is diabetes, uncontrolled diabetes. India is diabetes capital of the world actually. Now we have 11 crore diabetics and another 10 crore people who are in pre-diabetes range. So it has a lot of impact. Then high cholesterol, heart problems, heartbeat variation, we call it as atrial fibrillation. Smoking is very common risk factor. Then sedentary lifestyle, sitting, not doing much work. WHO World Health Organization tells sitting as a new form of smoking. It is as bad as smoking. So that we have to keep in mind. Then alcohol intake, excess alcohol intake. Then there is a condition called carotid stenosis. If there is a block in one of the blood vessels in the neck, that can cause stroke. So these are all common risk factors which can trigger stroke. So now, suppose if there is a stroke, patient has to go to stroke ready hospital. Stroke, you cannot go to every hospital because you will be wasting time. As I told, every minute after stroke is very important. If you identify, who will identify stroke? A public can identify stroke. A family member will identify stroke. Suppose you are traveling somewhere, you are in a bus stand, somebody will recognize that you are having some problem. So they have to shift to a stroke ready hospital. Stroke ready hospital should have a 24/7 running emergency department, ICU, one CT or MRI is a must. And it should be monitored by a neurologist or neurosurgeon. And there should be a plan of action on what to do for a stroke patient. So if this is there, then you can send to stroke ready hospital. Now, Government of India is doing what is called geotagging of all stroke centers. It means we have a GPS. Suppose you identify if this place is a stroke ready hospital, there is a GPS tag. Suppose you put stroke. Suppose somebody has a stroke 2 kilometers away. If it tells stroke, then they should know which are all stroke ready hospitals in his locality. Then he can choose to go to that hospital. That's what government is doing. And most of the government are giving what is called clot busting medication free of cost now. Tamil Nadu, it is available free, but all bigger hospitals now it is available. So only thing, patient has to reach on time. And when patient comes to hospital, we follow what is called 60 minutes rule. 60 minutes rule is an international standard, which means if patient comes to emergency department, you enter the door of emergency, within 60 minutes, stroke patient should receive the treatment. That is the rule, which means first 10 minutes, doctor will assess the patient. Then next 10 to 15 minutes, they will do CT scan or MRI, and they will come to conclusion whether it's a bleeding or whether it is a clot. And based on, we have some scales, we have some criteria. Based on that, within 50 minutes or 60 minutes, you should give the clot busting drug. Okay. So in Apollo, what we have internal benchmark of 45 minutes instead of 60 minutes. But in our hospital, because of our team effort, we are able to do it as early as 33 minutes. So that will have a lot of impact on how patient becomes better. Second is about doing a angioplasty to the brain. Suppose if there's a bigger blood vessel blockage, this clot busting may not help. So in such situation, what we do is we put a catheter from the thigh and directly put it. It's like a heart angioplasty. Instead of doing heart angioplasty, we go directly to the brain, pull out the clot and clear. In some cases, we can do up to 24 hours, which means if any patient has stroke here, you can access anywhere in this one. So accessibility is not a problem. But in India, the number of patients who are receiving this treatment is very less. The government data shows only 4.6% of patients are receiving blood thinner, clot busting medication. In Singapore, it is 30%. In America, it is 35%. So you have to compare with the benchmark. So our target as per government is to raise it to at least 20%. And the brain angioplasty we call mechanical thrombectomy, that the numbers are still less actually. We are getting only 0.7%, whereas globally up to 10% is the standard. So it is a collective effort. If you see, stroke was declared as a global health emergency in 2010 by World Health Organization. What is medical emergency or global medical emergency? Which means all government should put effort to build infrastructure for the patients. As of now, unfortunately, in India, it has not happened. So now, because of the efforts of the Doctors Association, efforts of the international bodies, and we have enough data, information is there. So now we are able to convince government, convince people to create infrastructure. Free thrombolysis took 6 years. In fact, I remember in 2012, insurance company refused to pay to a patient who received a stroke thrombolysis. Then we actually filed a case. Then we wrote to the government. Then government ordered all insurance agencies to give the insurance support for this emergency treatment. So it takes time, but it is not complete without help of all of you, that is the media, in raising stroke awareness in public. That is very important. Now at Apollo Stroke Clinic, what we are doing, our initiative is like a hub and spoke model. We have a bigger center in like Bangalore, or even if you see in Chennai or other places. So we have smaller units wherein patients will come. If you have 2 or 3 risk factors for stroke, if patient has a heart problem, if you are more than 40 years of age, then sometimes we do what is called carotid Doppler. So if we see any identify clots in the blood vessels of the brain, then probably we need to be very careful. This is a patient who may develop stroke. Second, we have a special tool called transcranial Doppler. That is a brain ultrasound basically. So that also we see, we identify what is the risk of stroke. So now Mr. Venkat will tell you our team when they are coming, but our plan is to identify high risk stroke patients. We are planning to give care to patients who are already suffering from stroke. I have been doing stroke clinics in Mandya near Bangalore from last 12 years. So most of the patients, even to come to Bangalore, they have to spend 3,000 rupees or 4,000 rupees because they are not able to come physical to the hospital, and they'll be wasting 2 days of time. So what we are doing, we are trying to help them by giving care at their wherever they are available. So in Tumkur we have started, and HOSUR we wanted to start long back. From 3 months he has been behind me, but we had some logistic issues. Dr. Kishore is there. Dr. Kishore is our consultant neurologist. He was trained in Narayana Health. Actually, he worked in Narayana Health for 5 years. So he is with us. So with help of all of you, we want to give whatever is best possible to the patient. End of the day, every stroke patient, as I said, the death rate in stroke is very high. But if you identify early, if you treat early, these are all the patients whom we can give a difference. If you see, 15% of patients with acute stroke, whatever I'm seeing, they are less than 45 years of age. If patient who is an active earning member of the family, he is the only earning member of the family, he develops stroke and he becomes totally disabled. He loses job. So there is lot of social problems. Earlier days, children used to get parents for stroke and heart attack. Now parents are getting their children due to stroke and heart attack because of stress and various issues. So the purpose of today's stroke, if they have risk factors, they can come for a stroke screening. We have Doppler screening available in the facility. We have other risk factor check, and if really needed, we do a MRI and other issues to treat this patient. And now the golden hour is 4.5 hours. You can reach any big hospital near your area, either government or private, within 1 hour. There is no problem actually. Only thing is you should recognize early and go to the hospital. So with this, I stop here. Any question you can.
Significantly.
Yes, sir.
So what
If they have risk factors, they can come for a stroke screening. We have Doppler screening available in the facility. We have other risk factor check, and if really needed, we do a MRI and other issues to treat this patient. And now The golden hour is 4.5 hours. You can reach any big hospital near your area, either government or private, within 1 hour. There is no problem actually. Only thing is you should recognize early and go to the hospital. So with this, I stop here. Any question you can.
Significantly,
Yes, sir.
what factors attribute to prevent this type of
Yeah.
strokes?
Most important is the BP control, sir. All of us, if you see, only 30% patients are optimally treated with BP medicine. Suppose somebody has a BP, he is taking either telmisartan or some tablet. But what is the guarantee that his BP is under control? So there was a study by government. They came to a conclusion that 70% of the patients are suboptimally treated. BP and sugar are two diseases which will kill you silently. Suppose I can recognize a stroke symptom the moment he comes walking to the my cabin, but I don't know what is his BP unless I check it. So that is most important. So now home BP check monitors are available. After COVID, it is available at a easy price, and also it is quality has improved. So BP monitoring at home is very important. Sugar control is very important. Cholesterol is very important. Smoking. If patient continues to smoke, medicines don't work. So that is very important. And in some patients, recently my student did a thesis project on how blood thinners work. Some of the blood thinners won't work in some patients, like aspirin, clopidogrel. Some of you take because of other heart issue and other issue. No, some won't work in Indian patients. So we have to keep all these things in mind.
What is the facilities inside?
As of now, this is in this clinic. This is basically focused on preventive medicine. Now we have a full-fledged lab. We have a physician. We have all the cardiac support and everything. The related to stroke, what we have is a carotid vertebral Doppler. The Doppler screening of the brain blood vessel is very important. In fact, once we start, we have a brain Doppler machine. There is a TCD machine, which is a port in this clinic. This is basically focused on preventive medicine. Now we have a full-fledged lab. We have a physician. We have all the cardiac support and everything. The related to stroke, what we have is a carotid vertebral Doppler. The Doppler screening of the brain blood vessel is very important. In fact, once we start, we have a brain Doppler machine. There is a TCD machine, which is a portable machine. Actually, we are planning to get that also on specific days for screening. Especially that is very important in screening patients after stroke. Patient had a stroke now. They are under my follow-up. You cannot do MRI every time. You cannot do every test every time. So in such patients, to see how they are responding, what is the risk of next stroke, we can predict that. So other basic workup, everything is available here in our Apollo clinic. Only thing is the brain Doppler, which will probably get based on the need and numbers, because we already have a lot of patients who are treated from stroke. In fact, at least in a month, I get 15 to 20 OPDs for my old patients treated with stroke. So probably they will be the best beneficiaries, I would say, because they don't have to waste time. Second, once we start doing it, another area what I am looking at is the surgical risk. Suppose a patient is posted for a surgery, like a knee replacement or a gallbladder surgery. He had a stroke or he has a high risk for stroke. In such patients, recognizing the risk of stroke during surgery is very important. Otherwise, surgery is fine. Patient had stroke after surgery. That's what will happen in some situations. So those things we want to highlight. The preventive, as you rightly said, the stroke prevention is what I would like to stress in this setting. Increase. Automatically your diabetes, cholesterol level, BP, everything will increase. All these over 2 to 3 years will contribute to both stroke and heart attack. There are proven risks. These sedentary lifestyle, as I highlighted, stress and sedentary lifestyle are the new killers because we don't know what we are doing. In fact, once we cross 40, all of us have to retrospectively think, it is like your second innings. So you have to be little more careful. Okay. So recently, if you see, three of my consultant colleagues had heart attack. In a matter of 4 months, in in hospital where I work, three doctors had heart attack. They got a stent. Okay, because stress is invariably a problem. But it is not that you don't have to work. You need to grow in your life. Everyone, like you have stress, you have to attend one more program in next 1 hour, right? By evening, you would have attended 6 or 7 programs in this hot summer. That itself is a big stress for you. So stress is different from person to person. What is most important? Hydrate yourself well, especially 2 to 3 liters of water every day. Less salt intake. Having food on time is very important. You may eat little, but eat on time. Okay. And every day morning, at least spend 45 minutes for yourself. That is called me time. Today morning also, I'm a runner. I ran 5 kilometers and he called me to pick the vehicle. I said, I'm running, come after half an hour. So you have to have your personal time for your physical activity. At least, guidelines say that 5 days a week is enough. I will tell every day you do because invariably you are going to miss 1 or 2 days. At least that will compensate. So stress work is important. You have to, we will grow only by doing work. Okay. So, but at the same time, having these checks and balances very important. Annual health check is very important. Every year, if you are above 40 years, you have to undergo health check because that will pick up a lot of small problems. So if you attend that early, probably you can do well. In fact, one of my junior colleagues, she was my duty doctor 10 years back. Now she is working with me. She went for annual health check. She was diagnosed with a breast cancer. Now she's on treatment because it was a stage 1 breast cancer. Treatment is available and it's curable. So if you identify any disease in early stage, you can do well. 3 days back, we did a the surgery for a young 48-year-old lady. She didn't have any diabetes, hypertension, anything. She had a stroke. We did we call endarterectomy. The carotid neck vessel clot was there. We removed it. So disease can come to anybody. You cannot prevent it. It is your bad luck. But at the same time, awareness and negligence should not be there. If you are negligent, there is no excuse.
And one addition, we'll finish it up. Oh, we are done, sir? Or
Yeah,
we
yeah.
can sum it up?
Yeah.
I mean, before we conclude, as sir was telling, see why I wanted to mention this. Whatever the doctors say, nowadays people are not taking so serious. But when celebrities sonna, they take very serious. உங்களுக்கு அர்ஜுன் சர்ஜா தெரியுமா? அர்ஜுன் சர்ஜா. அர்ஜுன் சர்ஜா ரீசென்ட்லி ஒரு வார்த்தை சொன்னாங்க. என்ன சொன்னாங்கன்னா, இன் a day 24 hours இருக்கும். அந்த 24 ஹவர்ஸ்ல நீங்க 1 hour if you give it to yourself, it will add 23 years to your life plus your rest of the 23 hours will be very good because உங்களுக்காக 1 hour கொடுக்கலன்னா ஒரு நாளைக்கு, so what is the fun? So
That's way actually now Gen Z is having little more work-life balance. We are all committed to work so much that so that is where. So one more thing, I have written a book on stroke in Kannada language. It got best medical literature last year from Karnataka government. If whoever is can read and follow Kannada, we'll give a copy.
We are translating it to Tamil and English.
English is already, the brochures are there. So brochures we are trying to keep everywhere, so that that's what we are looking at. So anyone wants to slowly, sir, as this one from my side.